One point is that there's already a lot of online talk about why an 84-year-old woman would be, quote unquote, allowed to live on her own, why family members would allow that, especially family members who have a lot of financial resources. But one of the things that I just want to point out, though, is that a lot of people at this age, in their 80s, even in their 90s, really strongly resist wanting to go to any kind of assisted care facility or other kind of environment where they would lose their independence. In fact, this issue is something that so many families have arguments about. The children, the adult children of these elderly parents, and really wanting their parents to be in a setting that they would feel is more protective and safer for them. But a lot of times, their parents, the elderly adults, don't want to give up the autonomy. And it makes sense. A lot of times they want to stay in their home, they want to stay in a familiar surrounding. And this issue is actually quite complicated because sometimes for elderly individuals, when their environments change too much or too drastically, it can actually lead to an increase in negative mental health symptoms. So these issues, I just want to point out, are not easy at all for families to deal with and often involve, significant family tensions and conflicts.